So I want to talk to you about posterior ischemic optic neuropathy, PION. This is different than AION. A is for anterior. As you know, in the eye, what we're looking at is ischemia of the optic nerve. If you have AION, that means you're anterior to the lamina cribosa. If you have PION, you are posterior to this line. So in AION, we have a swollen optic nerve. That swelling is what differentiates A from PION. They're both ION, ischemic optic neuropathies. And you really probably shouldn't be making the diagnosis of PION because it is a diagnosis of exclusion. In AION, you have the two forms, the non-arteritic form of AION, which is by far and away more common, and the other form is arteritic anterior ischemic optic neuropathy. That's giant cell arteritis. In PION, we don't see any swelling, and so it's a retrobulbar optic neuropathy. And in an elderly patient, we're really going to be working up giant cell arteritis. Because PION is a retrobulbar optic neuropathy, we have to do an MRI scan of the head and orbit with gadolinium and fat suppression to look for enhancement of the nerve or some other cause of a retrobulbar optic neuropathy, whether that's neoplastic, inflammatory, infiltrative, or something else. And only if the MR is negative and there's no evidence of giant cell, then we can be thinking about PION, non-arteritic posterior ischemic optic neuropathy. The risk factors for PION are the same risk factors as AION, the typical vasculopathic risk factors: hypertension, hyperlipidemia, diabetes, smoking, atherosclerosis. But it can also occur after surgery, any kind of surgery, but usually general surgical procedures, especially spine surgery and cardiac surgery. But anything that lowers your blood pressure can cause PION. You should also know that PION can occur after hemodialysis, and any cause of hypotension or blood loss can result in PION. And you need to make sure it's not the usual suspects, infectious, inflammatory, infiltrative things, before you make the diagnosis of PION. Although the nerve is normal in the beginning, it's going to turn pale over time. And so the typical prototype PION, elderly, vasculopath, not giant cell, negative imaging. The patient has risk factors, the nerve turns pale over time, and then it just stays the same thereafter. As opposed to AION of the non-arteritic form, which has a small cup to disc ratio, patients with PION don't have the structural disc at risk, and so maybe that's why they have PION to begin with. So you should know a little bit about ischemic optic neuropathy, but especially anterior, both non-arteritic and arteritic, and a rare thing, posterior ischemic optic neuropathy, PION, a diagnosis of exclusion.